Hi, this is David Chang from the United States. And for my lecture at the meeting, I talked about toric IOLs and specifically how do we align them, keep them aligned, and then reposition them if they rotate postoperatively. One of the most important advances has been the use of digital marking. There's a system from Alcon. We happen to use the Zeiss Callisto, but this uses digital landmarks to allow you to precisely align the lens during surgery, because when you see an IOL postoperatively that's misaligned, you don't really know, is that due to surgical misalignment or rotation of the lens. My partner and I, Brian Lee, published in 2018 1,273 consecutive monofocal toric IOLs. Now, half were with the Alcon Acrosoft platform, half were with the J&J Technis platform. But ours was the first study from a single practice to use Callisto in every single case. Therefore, if the lens was misaligned, we knew that it was due to post-op rotation. And in every case, we evacuated viscoelastic from behind the lens. We avoided dispersive viscoelastic. And we left the eye a little bit soft because these are things that we felt reduced the rate of post-op rotation. What we found was that the Alcon platform, the Acrosoft, was statistically more stable, rotationally more stable. And this was true whether you looked at 5 or 10 or 15 degrees of misalignment. In this study, we rotated in terms of 10 degrees or more off, which is a significant misalignment, the Technis monofocal was 3 times more likely to be 10 degrees or more off. We shared this data with J&J, and they spent a great deal of resources looking at ways to improve the rotational stability of their monofocal IOL platform. And this resulted in the second generation of the J&J Technis monofocal toric. Instead of the ZCT, it's called the ZCU. And what they've done is to frost the texture of the outer haptic edge. It's that part that's in contact with the peripheral capsular bag. And in their in vitro testing and some early clinical experience, they found that this seems to reduce the rate of rotation. And this is now a standard feature of their monofocal toric platforms. It hasn't yet been introduced to the Symphony, but when the Symphony Plus comes out, it will have this feature to the haptic. At the last AAO meeting, my partner and I presented the expanded range of our study, which now includes many more monofocal IOLs, but also, for the first time, presbyopia correcting toric IOLs. Most of these were the Symphony. We had a few restores. In terms of alignment, the data showed that when it's a presbyopia correcting IOL, the rate of misalignment is really the same, which you would expect because these are the same platform. But the interesting thing is looking at the repositioning rates. So we had a total of, I think, almost 2,400 Acrosoft monofocal torics now, and the repositioning rate is 1.2%. When you look at the Technis monofocal toric, the repositioning rate is 3.5%. So that's 3 times as much, and that was more than 730 of the Technis torics. We looked at 780 Symphony torics, and the repositioning rate was double that of the Technis monofocal toric. So it was about 7%. So what this indicated is that we had to be much more aggressive about rotating a misaligned toric presbyopia correcting IOL. And of course, that's for 2 reasons. One, the patient is more likely to be unhappy since they're expecting near function, and also residual astigmatism affects not just the distance, but also the intermediate and the near acuity as well. So this is the first report to our knowledge of what a real-life repositioning rate is with a presbyopia correcting toric lens, in this case the Symphony. So hopefully the textured haptic will reduce the rate of rotation of the Symphony Plus, but it does show that rotation does still occur despite our best efforts. Now, altogether, we had about 54 symphonies that we rotated, and then more than 50 monofocal, both Acrosoft and Technis torics that we rotated. So in this series of well over 100 rotations, we were lucky that we had no complications and no subsequent recurrent rotations. This rotation improved the alignment in every case, and improved the uncorrected acuity and the residual astigmatism in every case. We did all of these rotations typically within a month of the first operation, with many of them being at around 2 weeks. What's happened is the capsular bag has contracted, and so it's a lot easier to get the IOL to stay where it is. But if you do it in the first month, there's really no significant capsular fibrosis, severe contraction, and so we were able to do our rotations with without viscoelastic and just BSS only, and this improved, I think, the ability to rotate and have it stay there. Thank you very much for your attention.